Estazolam is a medication that is used to treat insomnia, a sleep problem. It can help you fall asleep faster, stay asleep longer, and reduce the number of times you wake up during the night, allowing you to have a better night's rest. Estazolam belongs to a class of drugs called benzodiazepines, which work by producing a calming effect on the brain. This medication is typically only used for short periods of 1 to 2 weeks or less. If your insomnia persists for a longer period of time, it is important to talk to your doctor to explore other treatment options. The recommended daily dosage and the optimal timing for taking Estazolam should be determined by your doctor. Before taking Estazolam, make sure to read the medication guide provided by your pharmacist. Always ask your doctor or pharmacist if you have any questions. Take this medication by mouth with or without food as directed by your doctor, usually just before bedtime. The dosage will depend on your medical condition, age, and how you respond to treatment. It's important to note that this medication can rarely cause temporary short-term memory loss. To reduce the risk of this side effect, only take Estazolam if you can get a full night's sleep of at least 7 to 8 hours. If you have to wake up before that, you may experience some memory loss. If you find that the medication is not working as well after using it for a long time, talk to your doctor. It's also worth noting that while Estazolam helps many people, it can sometimes cause addiction. The risk may be higher if you have a substance use disorder. Make sure to take this medication exactly as prescribed to lower the risk of addiction. If your condition lasts after 7 to 10 days, or if it gets worse, make sure to tell your doctor. After stopping this medication, you may have trouble sleeping for the first few nights. This is called rebound insomnia and is normal. It should go away after 1 or 2 nights. If it continues, contact your doctor. If you experience dizziness or difficulty with coordination, be sure to let your doctor or pharmacist know. To reduce the risk of dizziness or falling, make sure to get up slowly from a sitting or lying position. Estazolam may make you feel sleepy during the day, so it's important to inform your doctor if you experience daytime drowsiness. Your doctor may need to adjust your dose. Remember, this medication has been prescribed to you because the benefits outweigh the potential risks. Many people who use this medication do not experience serious side effects. However, it's important to contact your doctor right away if you experience memory loss, changes in mood or behavior, or if you engage in activities while not fully awake, such as sleep driving, sleepwalking, or preparing food. While very rare, if you notice symptoms of a serious allergic reaction such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. And remember, it's important to discuss any concerns or questions about your medication with your healthcare provider. Estazolam can be addictive and has a risk for abuse, which can lead to overdose and even death. It's important to take this medication exactly as prescribed by your doctor. Avoid alcohol and other drugs that may cause drowsiness or breathing problems, as this can lead to serious side effects, including death. Your doctor will prescribe the smallest dose of Estazolam that works for you and will only have you take it for the shortest possible time. If you experience slow or shallow breathing, unusual lightheadedness, severe drowsiness or dizziness, or difficulty waking up, seek medical help immediately. Suddenly stopping Estazolam can cause serious withdrawal symptoms, especially if you have been using it for a long time or in high doses. Your doctor may gradually reduce your dose to prevent withdrawal symptoms such as headaches, restlessness, confusion, depression, nausea, or seizures. It's important to follow your doctor's instructions carefully to avoid these risks. Before taking Estazolam, make sure to inform your doctor or pharmacist if you have any allergies, especially to other benzodiazepines. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. Before using Estazolam, let your doctor or pharmacist know about your medical history, especially if you have kidney or liver disease, lung/breathing problems, mental/mood problems, or a history of substance use disorder or sleepwalking. It's important to disclose all of this information to ensure the safe use of this medication. Estazolam can make you drowsy, so it's important to avoid driving, using machinery, or doing activities that require alertness until you can do so safely. It's also important to avoid alcohol and marijuana while using Estazolam, as they can increase drowsiness. If you are an older adult, you may be more sensitive to the side effects of Estazolam, such as dizziness, confusion, unsteadiness, and excessive drowsiness, which can increase the risk of falling. Inform your doctor if you are pregnant or planning to become pregnant, as Estazolam may harm an unborn baby. It's crucial to discuss the risks and benefits of this medication with your doctor if you become pregnant. Estazolam may also pass into breast milk, so consult your doctor before breastfeeding while using this medication. It's important to be aware of potential drug interactions with Estazolam, as they can affect how the medication works and increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription/non-prescription drugs and herbal products. Don't start, stop, or change the dosage of any medicines without your doctor's approval. Some medications that may interact with Estazolam include sodium oxybate, ribociclib, and azole antifungals like itraconazole and ketoconazole. Additionally, the risk of serious side effects may be increased if Estazolam is taken with other products that may cause drowsiness or breathing problems, such as opioid pain or cough relievers, alcohol, marijuana, other drugs for sleep or anxiety, muscle relaxants, and antihistamines. Always check the labels on all your medicines and ask your pharmacist about using those products safely. If someone has taken too much Estazolam and experiences serious symptoms such as passing out or difficulty breathing, it is important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an Estazolam overdose may include slowed breathing or a deep sleep from which the person cannot be awakened. It is vital to seek prompt medical attention in the event of an overdose. It's important not to share Estazolam with others, as it is against the law. As you age, your sleep patterns may change and you may find yourself waking up multiple times during the night. It's a good idea to talk to your doctor or pharmacist about ways to improve your sleep without medication. They may suggest avoiding caffeine and alcohol before bedtime, skipping daytime naps, and establishing a consistent bedtime routine. These changes may help improve your sleep without the need for medication. If you happen to forget to take a dose of Estazolam, it's important not to take it unless you have enough time to sleep for 7 to 8 hours afterward. This will ensure that you have enough time to rest and avoid any potential side effects from not getting enough sleep. It's important to store Estazolam at room temperature, away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. When it comes to disposing of Estazolam, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.